An entire obstetrics department in BC has quit, leaving that province's Interior Health Authority under pressure to fill those roles. 7 OBGYNs at Royal Inland Hospital resigned on the weekend, citing what they call safety issues from a changing workload and staffing challenges. In a letter, the doctors said they hope this loss will motivate change to improve support for women's health. And for a closer look at the state of OBGYNs in Canada, I'm joined by Dr. Lynn Murphy-Kaulbeck, maternal fetal medicine specialist and president of the Society of Obstetricians and Gynecologists of Canada. Good morning.
Good morning.
First off, when the doctors cite safety issues, what are they referring to?
Well, they're referring to a number of things. One of the issues, I think, is lack of staffing, so lack of support, nursing, other healthcare providers that do with obstetrics. When you look at when you're short on obstetricians or you're short on pediatricians, whatever that may be, women often get delayed in induction or delivering, being prepared for delivery when they're supposed to. You also have the issue of transport. So oftentimes if you're short-staffed, you will redirect or send women to other facilities. And that in itself is loaded with a lot of safety issues in the fact that, women can be transferred in ambulance or by air when they're in labor. And it's, I think the biggest thing that's going on, or one of the main issues of this is just one hospital in Canada that this is happening. But I think people need to be aware that this is kind of a poster, I think, of what's happening, a poster example of what's happening, throughout Canada.
We're going to get that national picture in just a moment, but just to clarify for anybody at home, my understanding is their clients will still see them in clinic, the doctors that have left the hospital, but they're just not at the hospital for delivery. Is that right?
Exactly, and from the information that I have and speaking with others is that this is going to be a phased out approach, I think would be the best description. So they're going to continue services seeing women within their office, but as far as labor and delivery, they will phase out their services and women will have to go elsewhere for labor and delivery.
Okay, so then pulling out the focus, let's take a look across the country. How is this affecting other provinces? We've done stories before in Alberta where there's such a small number, and we have some of those numbers. I understand that there are about 6.3 OBGYNs per 100,000 people. Why are there so few specialists in this field?
That's a really good question. And I think one of the things is that you have to remember in Canada, healthcare is delivered on a provincial basis. So again, from a national perspective, in person planning what is needed, it's very difficult. We often don't have national data. And one of the things is, I think, as well, is obstetrics and gynecology, it's a tough specialty, and I think what you'll find is as people move forward in their careers, some will decide to not do labor and delivery anymore, or they'll, phase out earlier than what you may see in other specialties. The other thing is training. Do we have enough training positions in Canada for obstetrics and gynecology to fill the vacancies? And I think the numbers are quite clear that we don't. But I would also say to that, you can train and you can put people in place. But if you don't have the supports within the context of the institution or the health authority that you're working, you won't stay. And I think that's what we're seeing now is, people standing up and saying, I can't do this anymore. So it's multifactorial, but I think we really need to put our heads down as a national group and say, how do we fix this? Because it is happening in every province in Canada. I worked for, almost 20 years in New Brunswick. There were, continual repeated closures of obstetrical units because of lack of staffing. Same in Newfoundland, very difficult to get to rural areas. Nova Scotia, that's where I am now. Again, lack of OB-GYN, and it's particularly strong or particularly more relevant in rural and remote communities.
Yeah.
But it's not just there. We're seeing it in large centers as well.
Well, as you rightly point out, this is happening at the national level, but we know that healthcare is managed provincially. So where do we find the fix here?
Oh, that's an age-old question, and one that we grapple with all of the time. I think one of the things is, and if you look at the BC example and what's happening there, They talk about recruitment. They talk about bringing in locums, and I think you'll see the price of a locum. It was $7,100 per 24-hour shift. That's not sustainable. But I think one of the things that, again, with the provincial delivery of healthcare system, it makes it very hard as a physician to say, you know what, I'm going to go help my BC colleagues. I'm going to go do that. Separate licensure, it requires a lot of time and effort to get licensed in each individual province. So we need to look at pan-Canadian licensure. I think the other thing is when you're talking about obstetrical services, who are the providers? We have midwives, we have family doctors, we have obstetricians and gynecologists. What are the actual numbers that we need when you put that team together? And I would also stress that it's not just that team, it's also your nursing support, which is also important because we see labor and delivery units be closed because there's lack of nursing staff. So I think the other thing is from a training program perspective, and we've tried to do this over and over again, but what are the numbers that we need in order to sustain our maternity services across Canada? And that changes. And I think it's changing even more rapidly in the fact that the obstetrical population that we see is higher risk now for a number of factors: age, obesity, chronic medical problems. So it's a really complex issue. But it's something that we have to address because what we're seeing in Kamloops, I think you're going to start to see you are seeing in other places in Canada. People are stepping away.
And women in Canada are going to continue to have babies. We're going to need the OBGYNs and the support team that you highlighted. Dr. Murphy-Kaulbeck, great to have you on this morning. Thank you.
Thank you.